Okay, so next question we've got is from a GP about antibiotics for sinusitis. What is the role of antibiotics in acute sinusitis? Okay, so we've got to differentiate between acute and chronic sinusitis, and given that you've specifically asked me about acute sinusitis, that makes sense from a clinical point of view from GP side of things. The first thing to make a comment on is that most patients that think they've got sinusitis have rhinitis, and most of it is not infected, it's allergic. So you've got to differentiate between the person that's getting the blocked runny nose because of hay fever allergy type things versus the person that's sick. And then the person that's sick, they've got the temperatures, they've got the sweats, they've got the purulent nasal discharge. And then you sort of weigh it up. You go, how much pain are they in? How much are they systemically unwell as to the role of antibiotics? If it's more of a hay fever allergy type thing, then antibiotics are not your first go-to. This is important for allergic rhinitis. Antihistamines are not your first go-to. Nasal steroid sprays are. The guidelines have said it, and that's been common clinical practice amongst a lot of ENTs that deal with nose and sinus problems. Is we go straight to the steroids. We don't go to the antihistamines as a starting point. We use that as an adjunct to salvage things. So a patient comes in saying, "Oh, I've got sinusitis." Dig a bit deeper. What do they mean? Do they mean that their nose is all blocked and runny? Because that's not sinusitis. Do they mean that they're sneezing a lot and their nose is really itchy? That's not sinusitis. Do they have a cold and a runny nose that's flared up and now they've got facial pain and pressure and terrible headache and their nose is all clogged up and their sense of smell is gone and they've got this stuff running down the back of their nose and it's hard for them to clear it, but when they blow their nose they get a little bit of green stuff come out? Yeah, that's acute sinusitis. And then how sick are they? Well, if they're sick enough, start treating them. And antibiotics perfectly reasonable in that context.